we're going to the minutes from the previous meeting. Do I hear a motion to pass? Sharon Fagler, are you in agreement?
Yes.
Ron?
Yes.
Yes. All in agreement?
Yes.
Okay, no questions. So the minutes have passed.
The second item on your agenda is the work session of the Board of Health. I am able to provide an update on the coronavirus and response. So the town has, in response to the coronavirus, has shut down some of its regular functioning municipal buildings, so access to the public has been limited. We are still open for business, just not open to the public. We are continuing our day-to-day activities and trying to get our work done in a limited capacity. I've been in constant contact with the Department of Public Health and the Barnstable County Health and Environment. We have an increase in the number of cases day by day, and we expected that to happen. And because we are now seeing community spread, not specifically in the community of Harwich, but in the community of Barnstable County and Massachusetts, that's not related to travel to China, we're imposing more restrictions like public gatherings over 25. Restaurants are not able to serve inside to the public. It's takeout only. These measures are in place to try to limit people's contact with other people so we can slow the spread of this. And I think, Pam, if you want to go one by one with questions, we can handle it that way. Questions or comments?
I'll start with me. I have one question. How many confirmed cases in Barnstable County are there?
As of 4 o'clock this afternoon, there were 2 confirmed cases. It is a 2 people that live in the same household, and they are from the town of Sandwich. Their close contacts have been notified, so if you have not been notified, you are not one of their close contacts.
Okay, thank you. Sharon, any questions?
Yes. So you just answered Barnstable County. So in Barnstable County, is that all of Cape Cod? Is that considered all of Cape Cod?
Barnstable County, there's Barnstable County, Nantucket, and Martha's Vineyard. And of those 3 places, just the 2 cases.
Okay. And you may not know this, but do we know how many people here on Cape Cod were actually tested?
I don't have that number. I think Cape Cod Healthcare is providing that the number of tests that they're giving.
Okay. Okay. Yeah, no, I think you're right. All right. All right, and then as far as the plan, are we asking questions on that now or just?
The plan that I sent this afternoon?
Yeah.
If you have questions on the plan, you can contact me. That wasn't part of the public packet, so I'm not sure we should be talking about that.
Okay. Other than that, right now I don't have any other questions.
Okay, Ron, any questions?
I don't. No, I've been listening to the news, and I think you're right. There's 2 cases that they've known about, but I think this is supposed to be isn't there supposed to be something at the 4 Cs for testing if they wanted to do some testing or something like this?
Yes, Cape Cod Healthcare and partnering with Barnstable County Health and Environment have started a drive-through testing facility at the community college. It is not a free-for-all where if you think you want to get tested, you can go there. You do need to first contact your doctor, get a doctor's order, set up an appointment. Yes, yep, set up an appointment. So if you just message to the general public listening to this, It's not a open testing center where it's a drop-in thing. You need to have an
No, you
appointment.
just don't drive through and get tested. Yes, it has to be
Right.
by a doctor's prescription, so to speak.
Exactly.
Anything else, Ron?
Nope.
Matt, any questions?
No questions.
Okay.
Okay.
Megan, can we go back quickly to the minutes? So I just want to be clear, I didn't hear a motion or a second. So if I could just get a clear motion or a second.
Sorry.
and-
Okay, that's okay.
And Pam,
I'll make a motion.
Pam, with
Okay.
anything we're doing remotely, all votes need to be done by roll call. So you'll go through all members and say Ron, Matt, Sharon, and yourself, and have a roll call vote.
But I need a second, right, first?
Yes, please.
Somebody second the
Second,
motion?
Ron.
Okay,
Second.
Got it.
so, Sharon, do you agree with the motion to pass the minutes?
Yes.
And, Ron, do you agree?
Yes.
Matt, do you agree?
Yes.
And I agree, and it's unanimous. Thank you.
Thank you.
Okay.
Okay, so the next item on our agenda is the continued review of the draft of Town of Harwich nutrient and pesticide control bylaw / education. I do recommend that you don't hear any discussion on this and continue it until a future meeting, because this is something you would like to have the public's participation in.
That's correct.
Okay, do I hear a,
Make a motion that we.
thank you, make a motion to continue it to the next meeting?
Yeah.
Yes.
Second?
Yes.
Okay, Sharon, are you in agreement with
Yeah.
the next meeting? And Ron, are you in agreement?
Yes.
Okay, and Matt, are you in agreement?
Yes.
And I am in agreement. All in favor to continue it?
Okay,
Unanimous.
great. Because we did not amend our agenda to say no earlier than 7 PM, I think it's prudent if we wait another 20 minutes or so and discuss other things, just to give the people that are on these hearings a chance to call in the meantime. So I think you could move on to permits, which is item 8 in the agenda packet. We do have one new stable permit, which is actually one that had been operating without a permit, so it's nice that they have a permit now. 7-Eleven is a change in ownership, so that is a new permit owner but same location. 2 other new ones, we have a new food truck, Dancing Spoons A Go-Go, and Foss Farms is an event permit. And then Handkerchief Shoals has changed hands as well, so same location, new owners.
Any questions from board? Do I hear a motion to?
I have a question on food trucks now. In this little episode we're in right now, where we're having this coronavirus, can food trucks be able to work right now, or are they just in the summertime?
I'd be happy to answer that. Food trucks, if they're licensed, are able to operate this time of year. It's not just seasonal. We have had one request from a restaurant who would like to start up a food service business, and what I told them was they would need to get a mobile food permit and go through the process of getting licensed, but they would not be in violation of that 25-person gathering rule. So if they wanted to do that, they could. Excuse me.
I have a question on that. They may not be more than 25 persons, but the distancing of 6 foot. If somebody comes up, I don't know what the truck looks like. So if they came up to the truck, would they have, from the person ordering to the person getting it, is that going to be 6 feet?
So that would be on the responsibility of the individual person, not on the responsibility of the food truck owner. They can put a sign that says, please remain 6 feet apart from each other. But just like standing in line at Dunkin' Donuts or the grocery store, people need to take responsibility for their own social distancing.
I was just wondering, my husband was in a store here in Harwich, and they actually had a table separating the customer from the cashier, so you were 6 feet apart. So I don't know whose responsibility that is, whether that would be part of the Board of Health to make sure that the person with the truck itself, who's owning this, is it going to be their responsibility to make sure that the people do stay 6 feet away?
They'll need to make every effort to do that. It's going to be hard to give someone their food and stay 6 feet away from them, but we are providing guidance to food service places. Yes, yeah. We're providing as much guidance.
Whether that would be part of our responsibility, considering we're telling the restaurants that they have to do takeout food because they want social distancing. Should that be our responsibility to make sure then that this is applicable at this time?
All we can do is provide the guidance. I don't think we have the staff to enforce it.
Okay. All right.
Leave the door open on purpose?
Mm-hmm.
Any other questions?
Sorry.
Do I hear a motion to pass the permits? I make a motion. Go ahead.
I'll make a motion to pass the permits.
I second it. Matt, are you in favor of passing the permits?
Yes.
And Ron, are you in favor of passing the permits?
Yes.
Sharon, are you in favor of passing the permits? Yes. And I am in favor. The motion passed unanimously.
I was a little busy this month, so I wasn't able to get my February report in writing. I can give you a little update since we have a few minutes here. Coronavirus took hold of us at the end of the month, and we've been tracking it ever since. We've been dealing with putting plans in place for how to deal with it. I've been part of a COVID-19 subcommittee group with the Health Agent Coalition, and we talk frequently about what other towns are doing. It's nice to have consistency between town lines as far as how meetings are being held and restaurants closing and that sort of thing. So I think other than that, there weren't any big major announcements for the month of February. The travel that I was scheduled to do, I was supposed to be in Alabama right now, but that was postponed until further notice due to the state of emergency. Pam, if you want to go around and see if there's any topics that are Corona related that we want to talk about for a while. Otherwise, I believe Syed is on the line. We could open that hearing soon.
Sharon, any questions? Yes, I do have a question. On that, and I know we're not supposed to be discussing it, and we don't have to discuss it, on that, the continuity of operations, Are we going to have any kind of meeting where we can discuss that as the Board of Health? Because there's some things in there that I see would be the responsibility somewhere along the line of the Board of Health. And I'm just wondering if we, going to have any kind of a meeting where we can get some of this clarified.
I'm available the end of the week if you want to come in and talk to me about it, to find out what your thoughts are. We can sit at the end of tables, so we're not within 6 feet of each other, as to answer your questions, and I can walk you through our 3 binders of emergency plans, if you'd like to do that.
All right. I would like to do that, yeah.
Okay, and that offer is open to any board member who wants to know what their roles and responsibilities are during this emergency. We are the lead agency as far as setting the stage for closures, and we have the ability to override most select board decisions if we find that the public's health is at risk. So it's a lot of responsibility. We have isolation and quarantine orders we can issue, and we are responsible for contact tracing and monitoring of folks that have been overseas and coming back. We've got a lot going on here at the health department, and we may need to call on you for some helping hands in the near future, but come on in, give me a call, and we can set up a time to go over everything.
All right, do you want me to call, I can call Jennifer, or is somebody in town hall that I can call?
Yes, town hall.
They're during the day.
Yep, all employees are inside town hall. The building is locked to the public, but we are here answering phones and emails. We're conducting business as much as we can, as usual, giving people the opportunity to ask us questions. So if you want to call, we can set something up.
That'll work. Thank you.
You're welcome.
Ron, any questions?
No.
Matt, any questions?
No questions.
I'd like to just make a comment. I am very proud of Cape Cod Healthcare in their effort to reduce any spread, especially at the hospital where I work. It's phenomenal the amount of things that have been placed to protect staff and patients, and I'm very proud of their accomplishments. That's all.
Okay. I think it's safe to start the hearings if everyone agrees, or if there's something else we would like to talk about.
Nope.
Okay.
Sharon, are you okay to start the meeting? Or? Yes. Okay. And Matt?
Yes.
Okay. Then let's continue.
Okay, we have a continued hearing for 7-Eleven Syed Naqvi, appeal of an order and fine issued by the Health Department for violation of the regulations of the Harwich Board of Health restriction on the sale of tobacco products, Section D and 105 CMR 665.010, minimum standards for retail sale of tobacco and electronic nicotine delivery systems. This is a continued hearing from February 18th, 2020. Hand it over to you, Pam.
Okay, I open the hearing. I will take comments from the board. Sharon? I just have a couple of questions. I think at the last meeting that we were at and we discussed this, one, we wanted to make sure that it was turned back to the company. Is that 7-Eleven that we're showing on the new permit? Under new ownership?
Yes, in your packet, you received a letter from the previous owner, and one from 7-Eleven, the company themselves, indicating that they,
LNG Convenience Inc.
yes.
Okay, all right, I see it now. It's on the other side of that. All right. And I think one of the other questions was that we had, he had said he didn't have the ability to pay the fine, and I guess there were some questions to verify, in fact, that he really doesn't have the funds to pay that.
I was thinking about this, and I don't know if we have the right to ask him of his financial situation. Megan, anything on that?
That's correct. I did provide some recommendations in your packet. The Board of Health doesn't have the ability to reduce the fine because it's set at a state level. So you really only need to decide whether or not he is responsible to pay it, or if he's not responsible to pay it. If he is responsible to pay it, you can refer him, we can do a criminal complaint and send it to the court system where they have the ability to reduce the fine. Your other option is to find that he's not responsible for the fine at this time and dismiss it.
I think we should dismiss it.
I would go along with that.
Matt? Any discussion?
No discussion.
Okay. Do I hear a motion to dismiss this fine?
I make a motion that we should fine for, I can't pronounce his name, and make him not responsible and dismiss it.
I second it.
Okay, and Matt?
Yes.
And Sharon is in agreement?
I agree.
And Ron is in agreement?
Yes.
And I am in agreement, and the motion's passed unanimously.
Okay, I see that Syed is on the line still. Unless he has questions, he's able to disconnect if he would like to. On to new business. Item A, hearing the Deacons Folly Realty Trust, 21 Deacons Folly Road, to consider a variance request to upgrade a Title V septic system prepared by Ryder and Wilcox Incorporated. Variances from Title V, minimum setbacks to allow a proposed soil absorption system to be 5 feet from the north and west property lines where 10 is required, variance request of 5 feet. And second, to allow a soil absorption system to be 10 feet from a full foundation where 20 is required, a variance request of 10 feet.
I open the hearing. Is anyone here?
Stephanie is
Yes.
here.
Oh, it's Andy Grover
It's
from
Andy.
Ryder and Wilcox.
Oh, okay.
Hello, everyone. May I speak about this project here? Do I need to be recognized?
Yes.
Okay. Yes. Thank you. Again, it's Andy Grover from Ryder and Wilcox, representing the Deacons Folly Realty Trust and their property of 21 Deacons Folly Road. This property has an existing 6-bedroom multifamily dwelling located on it. The property itself contains just over 21,000 square feet of land, and it's bordered on the south by a wetland and by sand pond. A majority of the property is within a buffer to a resource area, and on site there are 2 existing septic systems that are comprised of septic tanks and leach pits, and they're proposed to be upgraded into a single septic system. Similarly, the existing multifamily dwelling is proposed to be rebuilt in the same footprint with the same number of bedrooms, reducing down to a single-family residence rather than a two-family residence. Due to the proximity to the resource areas, a full upgrade and compliance with state and local regulations is not feasible. As proposed, the new septic system for this site will be a significant environmental improvement over the existing. The proposed 1,500-gallon monopore septic tank will improve wastewater treatment as it allows for increased settling of solids and enhanced anaerobic digestion of wastewater constituents. The proposed soil absorption system increases the separation distance between the bottom of the system and groundwater and will be outside the 100-foot setback to the wetland resource area. As Megan had mentioned, the variances we're seeking are the soil absorption system to the north and west property lines. 5 feet is proposed where 10 feet is required, and we're asking for a 5-foot variance there. And the soil absorption system to the full foundation, we're proposing 10 feet where 20 feet is required. That is a 10-foot variance we're requesting for that. Also, we're moving from well water on site to connecting to town water. And we see this proposed septic upgrade as an improvement to the site. It's putting the leaching component of the system beyond the 100-foot buffer where the current leach pits are within 100 feet. And we're bringing the system up with the exception of those 2 variances, the rest complies, and we're not asking for an environmental variance, just setbacks to property lines and foundation. If the board has any questions, I can answer them. Thank you.
Can I, recommendations from the health director?
And you can see me now. I figured out how to turn my camera around. So this is an existing property. The homeowners are looking to increase their habitable space. So because this is close to a resource area and they are increasing their habitable space, I do think you should look into the possibility of adding alternative technology to remove some nitrogen. They are maintaining the 100-foot line to the resource, however, they are increasing their habitable space. So any variances that they are looking to add, that they're looking for now, would be required whether or not they were changing their building from single to back to a single, but it's something that I think you should think about doing. And if you do decide to require the alternative technology, then a operation and maintenance agreement would be required. And regardless of that, my recommendation is to restrict the property to a maximum of 6 bedrooms and to have that recorded at the Registry of Deeds.
Okay, I'll accept comments from the board. Any comments, Sharon?
Yeah, all right. Is it bigger than what it had been?
No.
Is the house itself, are you doing anything with this, or are we just looking at the septic system?
Pam,
The house itself is being
sorry, I was just going to say, Pam, you should say the person's name to be recognized so people aren't talking over each other.
Okay, this is Sharon.
I thought I did. Sharon?
Yes.
You have questions?
Yes. Is the house staying the same size, and all we're considering is the variances with the new septic system? Am I reading this correctly?
Pam, you can ask either myself or the applicant to answer that.
Oh, I'm sorry. Sorry. Megan, could you answer it, please?
Sure, the applicant is looking to raise and replace the building, but keep the footprint the same. It's currently a two-story house. It's going to be a two-story house. They are adding a finished basement, so that's the added habitable space that I was talking about.
Yeah, all right, okay. All right, that was, so basically, we're increasing the habitable space, even though the footprint itself isn't being enlarged. So, all right, yeah, so in other words, I was thinking if it was being enlarged, then we could have said, maybe you don't need to enlarge it, but we're going up, not out.
But
Or
they're
down.
basement.
Down. We're going down, not up, yes, all right, okay, that answers my question.
Okay. Any other questions, Sharon?
No, I'm good.
Ron, any questions?
Nope.
Matt, any questions?
No questions.
Due to the, I want to say that I am in agreement with having them have the innovative alternative septic system. They're adding a full basement with a bath. So I'd like to hear a motion on, am I doing this right, Megan? Is it time for motion?
Well, someone would need to make a motion that included alternative technology. So you're just doing your discussion where you are discussing that you would prefer to incorporate it.
Right, so now we're looking for a motion.
I would make a motion to accept this, along with the recommendations that Megan has made for the alternative septic system.
Do I hear a second?
Second.
Okay. So Sharon, you're in agreement?
Yes.
Okay. And Matt, you're in agreement with the motion? And Ron, you're in agreement with the motion?
Yes. Yes.
And so am I. So the motion has passed to have the corporation of a innovative alternative septic system. Comments from Andrew Grover?
That sounds good with me. The incorporation of the IA septic system, we can accommodate that.
Oh, that's good. Good. Megan, are we set then with that?
We are.
Okay. Thank you very much.
Okay, thank you.
I have a question.
Who's this?
What did you decide about my case? I didn't hear that.
Oh, we thought you were on the line. If you want to go ahead, Pam.
Sorry. We are foregoing the fine to you. We felt on further thinking about it that we had no right to look into your finances as a board, and so we're waiving the fine.
Waiving the fine?
Yes, you're not responsible for the fine.
So what means I have to pay?
No, you do not have to pay.
Oh, okay. All right. Thank you very much.
Oh, you're welcome. Sorry you didn't catch that before.
All right. Thank you.
You're welcome. Go ahead. Okay.
Okay, the next hearing we have is Patterson, 15 Pinewood Lane, to consider a variance request to upgrade a Title V septic system prepared by Roder and Wilcox Incorporated. Variances from Title V minimum setbacks to allow a proposed soil absorption system to be 15 feet from the cellar wall where 20 is required, variance of 5 feet. And that is the only variance request.
I open the hearing. Can I hear from Stephanie?
Yes, hi, this is Stephanie Sequin. Hopefully everyone can hear me.
I think so, yeah.
Yeah.
Okay. So I'm with Ryder and Wilcox. I'm representing Brian Patterson, who is the trustee of the trust that owns the property at 15 Pinewood Lane. It's a little over 6,000 square foot lot located to the south of Lower County Road. There's an existing two-bedroom house that was built in the early 60s in somewhere around 1976. Mr. Patterson's parents bought the house, and it's been in their family ever since. The property has since passed on to the children of the original owners. There are two cesspools that I believe are original to when the house was built in 1961. They are functioning, but the family feels that it's maybe a matter of time before they start to have a problem with them, and so they're being proactive and going ahead with an upgrade. Look on the plan, between the setbacks to the property line, the setbacks to the building itself, there's very little room for a new system to be located here. It is on, most of the house is just on a crawl space that's maybe 2 to 3 feet deep. There is in the back of the house a small section that is maybe about 6 feet high, where the mechanical equipment is, but otherwise, for the most part, the house is just on a crawl space, with the exception that's on a slab. So what we're showing is a new 1,500-gallon septic tank, a leaching chamber system that has capacity for just over the 220 gallons per day that's required for the two bedrooms. We are holding the 10-foot setback to the property lines and just fitting in what we could for the leaching system. And at the closest point, it's 15 feet from the corner of the building where a 20-foot setback is required. So we are requesting a 5-foot variance from Title V. We dug soil, did test holes in the area where the system is going, and verified clean sand with a perk rate less than 2 minutes per inch, and no water encountered to 11 feet in both holes. So there are no wetlands in the vicinity of this property. It is not in the Zone 2. It's served by town water, so not an environmentally sensitive area. So that is the one variance that we're requesting, and I would be happy to answer any questions. Thank you.
Okay, thank you. Can I hear the recommendation of the health director?
Sure. This is an existing two-bedroom home. It's not being increased beyond that 2 bedrooms. Existing cesspools are to be abandoned, so this is a better situation than they're currently in. I recommend approval of the variances with the following conditions. The dwelling be restricted to 2 bedrooms, no increase in habitable space or square footage without further review by the Board of Health, and that the variances be recorded at the Registry of Deeds.
Okay, thank you. I close the hearing and open up discussion. Sharon, any comments?
I have a question more on process for Megan. I noticed on the sheet that comes with it, that it says please choose application type. And I take notice at the bottom that the things like letter to the Board of Health, letter to a butter, all those things there at the bottom, nothing is checked off. And I noticed they were checked off on the previous one. Is there the fact that it's not required to have the conservation approval, is that the reason why these things down at the bottom aren't checked?
All those things were received, and we did get all of those things. I'm not sure why they weren't physically checked off, but
All right.
we did get them all.
Okay.
Yeah, we have them all.
Okay.
Yeah,
Right.
no, we have them all. We'll be getting the green cards from the engineers. We'll reach out to them tomorrow and have them mail them to us or drop them off outside the door. But we'll get those things. But everything was as it should.
Okay, thank you.
Ron, any questions?
No.
Matt, any questions?
No questions.
Okay, do I hear a recommendation
Motion.
to pass what Megan said?
You need a
Okay,
recommendation.
I'll make this is Sharon Peter. I make a recommendation that Megan's recommendation. Yeah, I'll make Megan's recommendation.
A motion.
Do I hear the motion? Sorry. So, do I hear a second?
Second.
Second. So Sharon, you are in favor of the recommendations of the health director?
Yeah.
Matt, in favor of some direction of the health director? And Ron, you're in favor?
Yes.
And I am myself. Motion passed. Recommendations passed. Any comment from Stephanie?
No, I'm fine. Very good. Thank you very much.
Okay, thank you.
Night.
Good night.
The last thing we have on our agenda tonight is an environmental impact review from Eastwood Companies for 3, 7, 15, and 16 Bascom Hollow, an environmental impact report to demonstrate compliance with Harwich Board of Health Regulation 1.211, plans prepared by Clark Engineering, LLC.
Good evening. Bill Riley, David Clark, and Bill Marsh are here ready to participate.
Okay, go ahead.
All right, David, would you please declare our position?
So this is an existing subdivision with 8 lots, and was approved almost 2 years ago. The road's been put in, and 3 houses are completed. At the time the original subdivision was approved, both the town and the applicant were under the impression that sewer would be available sooner than later. So we came to the board, and the board approved the groundwater impact report that specified that we would put in a shared system for the first 4 dwellings, and that shared system would be for 4 bedrooms for each lot, and the system would not have IA technology. The entire subdivision has been dry sewered, and in anticipation of being hooked to the sewer. Now we find out that sewer is not coming to the property this year, and Eastwood Companies would like to keep moving on the other lots on the subdivision. As I said, 3 lots have been developed. 1 is under agreement, and pursuant to the original approval, that would be the last lot that would be able to be developed. So what we're asking is for the board to reconsider the groundwater impact report and allow us to keep going and construct the 5th, 6th, and 7th houses in this subdivision. Knowing that sewer is on the horizon, but we don't know when, as Megan said and states in her report, that it is part of phase 2, but this portion that goes by this subdivision has not been funded yet. So that would be our proposal, is to allow the other 4 lots to be developed, knowing that the sewer might be available pretty soon.
This is Bill Riley. I'd like to add that the three recommendations made by the health director, I think the number one is the most appropriate. This is all done in anticipation that the sewer would, in the first phase or second phase, would actually be in front of our property, and we do expect it soon. I would guess in the next year or so. And the added expense of doing IA, it would just be money basically thrown away when the pipe finally does arrive, because we're obligated to hook up when the pipe does arrive. So I would ask you to keep that in consideration as well.
And this is Bill Marsh, and I'd like to report to you that we have one more house. We built 3 houses, and they're on the system that's in the ground now. We have a 4th house that's sold that we're ready to build for a customer that can be hooked into the existing system. And then, as things would have it, 3 more houses have recently been put under agreement for us to build on a custom basis within the last 2 months. 2 of them happening last weekend. And in the current virus environment, we as a building company are looking very hard toward doing more of the custom work that we do, because we know that it's economically viable and good for our company and keeps everybody employed. So we're looking for an increase, at least of today, of an ability to build and wastewater 3 more homes. Thank you.
Thank you. Do I hear, please, Megan, Director, give your recommendations?
Well, I can give you some background on what Regulation 1.211 is. We have a couple newer members. Our existing regulation was put in place prior to any CWMP was ever enacted, and it says that any lots with any subdivisions 5 lots or greater that are within this Pleasant Bay watershed that will have a gallons per day over 2,000, which this would be included, are required to have a community system with nitrogen reducing technology. Now, with the CWMP in place, phase 2 of that is in the middle of being worked on now, and that this subdivision is within phase 2, but because of funding, the phase 2 has been split up into 3 different contracts. Contract 1 is underway, contract 2 is underway, and contract 3 is the remainder of the lots, and that has not been approved because we're waiting for funding. In order to get funding, we need to go to town meeting and get approval for that funding, and then get a contract and start the work on that. Best case scenario would be looking at a September, October, November special town meeting to have this on the ballot. It's not slated to go on the May town meeting, so it would be a later town meeting. And should the approval happen, we would be a couple years out. So in your packets, I do give 3 recommendations. Allow the newly released properties to have traditional systems on their own lots. That's one way you could go. The other way you could go, which is something I would recommend a little more heavily, is to keep the 4 lots that are currently on the community system as they are with traditional systems, and have the new 4 lots have individual Title V systems that have nitrogen reducing technology. The third, which is extreme but within your purview, is to require innovative alternative technology on all of the lots, which would mean retrofitting the existing system that's there for 4 lots and then creating either 4 individual IA technologies or having a second community system. Now, the recommendation that I'm leaning towards for my biggest recommendation is to have IA technology on the newly released lots and give those lots the option of not hooking up to the sewer within 45 days of availability like we had with the systems that are not alternative. So we would give them a longer hookup time. So that's something that I think you should discuss before making any motions.
Thank you. I close the hearing. I'd like opinion of the board. Sharon, questions?
Yeah, I do have some questions. I understand the predicament that they're in, and I'm putting on my wastewater hat. My biggest concern is the fact that we don't know whether contract 3 is going to get approved, if and when. All right. I know there's some talk of maybe going that the areas in with contract 3 could end up at a different phase of touring. Could be way down the line. If that's the case, then my concern is the impact that this would have possibly on the Pleasant Bay watershed. And that is a concern, and that was one of the main issues of the CWNP. With that in mind, I would have to say I would go along with kind of what I think Megan is leaning toward, which is the number 2 on the sheet that you have handed out here. That it would be an alternative septic system only on the newly released lots. To me, that makes sense. Leave the ones that are already in place that will hook up at some point. I'm okay with that, but I think these new ones, I guess I'm not really sure what they would like to do versus what you're suggesting. And I guess that question goes to Megan.
What was the question? I heard you liked that recommendation, but
I got the impression that what you were leaning more toward recommendation number 2. All right.
yes.
So what I'm saying, what is the difference between that recommendation, which makes sense to me, versus what recommendation they would like to do?
So their first choice is to have individual lots with individual septic systems that do not have nitrogen removal. So straight conventional Title V systems. That's what their first choice is.
And I would have an issue with that because I don't know when we're going to get, when that contract fee is going to be done. Because it may not happen. If they decide not to do that right now, that should get postponed for 5, 10, 15 years. If those areas go into a different phase in the CWNP. Mm-hmm. So no, I would not be in favor of Title V there. I could go with number 2. Those are my comments.
Okay. Ron, comments? Oh, I'm sorry.
I would go with number 2. Ron.
Okay. Matt, comments?
No comments.
Does somebody from Clark Engineering want to comment on what we've said?
Well, I think this is Bill Riley. So, a couple of, first of all, the Pleasant Bay watershed is the most important watershed in the town of Harwich. We recognize that, and that's why the regulations are written the way they're written. So the concern that somehow the Pleasant Bay watershed is not going to be sewered, after spending all this money to hook up, I think is unrealistic. I think Megan's suggestion that it's going to be go to a town meeting in the fall and constructed within 2 years makes a lot of sense. And so the only So we think that the contribution, first of all, I mean, none of the houses are built. They're all going to be built over time. They don't spring up out of the ground, in a couple of months. And so the actual effluent contribution to the groundwater is very, very small. And
What
we
is
think that
your timeline for building houses?
we think it would take at least 2 years for all the houses to be built.
Well, and or occupied, I think was your real question.
This is Sharon. My concern is, and I understand that's 2 years. There's a good possibility that this contract 3 won't go through. If it doesn't, and we don't end up finishing this portion of Pleasant Bay area, I'm sorry. You may think that's ridiculous, but I think we need to take the environment into consideration, not just economics.
This is David Clark.
Wait a minute. Let me finish. The CWMP was put into effect for a reason, and it was approved. All right? The fact that the town is now looking to change, possibly not sewering that section of what was phase 2, I think leaves this open to further discussion as to how that would affect the CWMP. So I guess my thought would be, if you want to wait until after the meeting, like it's May or September, and they decide whether or not the town's going to fund that contract 3, if it doesn't, I don't know where we stand with that, and then I think it does have an effect on that Pleasant Bay watershed.
This is Bill Martian. I can tell you, as a builder, as customers ready to build houses for in this environment, that's not economically feasible. This is David Clark. Regarding the impact to Pleasant Bay watershed, I would have to agree with Bill Riley's comment that the portions of the sewer system that aren't funded right now, a majority of it are the houses that are closest to Pleasant Bay. And it makes absolutely no sense that the town would not proceed with protecting Pleasant Bay by taking majority of the houses that have the direct impact out of the watershed, the sewer from those houses. The second thing to consider is this particular property is quite far away from Pleasant Bay. Wastewater that's placed around.
Which piece?
Oh, good. So this property is so far away, any wastewater placed in the ground today isn't going to reach Pleasant Bay for decades. And by that time, the houses that have been sewered, that are part of the first contract of phase 2, particularly along Church Street and in that area where they're actually working now, will all be sewered. So,
okay, excuse me, but this house that's the furthest away, which, at number 4?
well, I mean, because the distance overall is so great, it really doesn't matter which lot. They're all so together. They're all so far away.
Please? You're building a 4th house. This house you're talking about, in the scheme of the 8, which, is that the next one to be built?
You can say yes. Yes.
Okay, thank you. Go on, please.
I've finished my comment.
Okay. Sharon, any other questions?
So you're saying this is only one more house? Is that what you're getting at?
No. There's one more house under the original approval by the Board of Health that can be constructed. We're asking for 3 additional houses.
So basically, we're going to have 4 houses then with Title V septic systems.
No. The 4th house to be built is part of the community system. So that's already in place. Right.
I don't think we have any issue with that house. It's the other three.
The other three.
Right, that's what we're talking about. Like David said, 5, 6, and 7.
All right. So then we're looking at 3 houses that would have Title V.
That's correct.
And so where are their locations?
They're the lots closest to the street. Oh, no. Oh, yeah, closer.
So waiting until we see whether or not the town approves contract 3, which would be possibly September. So you're saying that waiting these few months, considering everything else that's going on, would be not economically feasible?
Well, the problem is, 6 months away. You know, we have people who are ready to sign contracts or have signed contracts, and if we say that we don't know what we're going to do until September, I guess if the issue is we have an agreement with the board that if we don't get a vote on the issue this fall, that we would add IA. Individual systems. Yeah, individual systems. Yeah. So in other words, what we'd ask you to do is agree to option 1 if we get the vote in September. If the town doesn't vote in September, then we'd be obligated to put IA on each of these 3 new lots. Before the seal.
Megan, is that something?
I think that's a reasonable request if we approve the release of these lots with traditional Title V's, with the understanding that if a vote is not made by the end of the year, I would say September is maybe a little early. We're probably looking more at October. But if a vote is not made by the end of October to include Phase 3 in funding and moving forward, that these lots have alternative technology added on to their Title V systems.
Right.
I could go along with that. I would like
Sorry, my cats.
This is Bill Marston, owner-developer, and that's something we could easily agree to, because by the time we get started on these houses, we could hold off until October-ish to install the septic systems, because these are houses that are not thought to be occupied before Christmas or even into 2021. So we could easily hold that off, and if your vote went the other way and just say, okay, we'll put IA in, that's an easy jump to make. Thank you.
Okay, I can agree.
Okay. Do you have any questions, Ron?
That sounds logical. I have one question. What happens if it doesn't come up before, and it doesn't come up in September or October?
Well, we have to add the IA.
Mm-hmm.
Yeah, I can see that. I would hope that we could do something by then, but considering what we're dealing with COVID-19, there's possibilities that even the May meeting could have some issues. So, but I think that is a reasonable way to pursue. Megan, would you agree with that?
I do, and I think we can revisit this also in September or October as we're learning more about what town meeting's going to look like. or a special town meeting's gonna look like, so we can move forward with the traditional septic systems, and if the houses aren't quite finished or systems aren't in, we can revisit it when we know more.
Any questions? No. How would you like this to be?
How do we do this?
We can talk about that on the phone tomorrow.
Megan, how would you like to word the motion?
I would recommend that traditional Title V systems be incorporated into the remaining lots and on individual Title V systems, and should a decision on Phase 3 not be made by September, that these systems then incorporate IA technology for nitrogen removal.
Excuse me, this is Bill Riley again. I like the end of October better than September.
Is that something you would consider, Megan?
Sure, we can even say, if there is a special town meeting in the fall. That's still up in the air. We don't know if we'll have one or not. Instead of end of September, we could say, at the conclusion of the special town meeting in the fall, we'll know if we're moving forward with contract 3. If there's not a special town meeting in the fall, then by the end of October, these dwellings will have alternative technology incorporated into their septic designs.
Would that be something that you would put into, since we don't have that on here, but that would be something that would be written up then? Or
Yes.
the fact that
Yep, we'll write it into the minutes for approval, and we will write the recommendation in the approval letter without that language in it.
I make a recommendation that we accept the proposal that Megan put forward.
Do I hear a second? No. Sorry, Ron? Will you second it?
Yes, second. Yes.
Okay. Matt, are you in favor?
Yes. Yep.
And Sharon, you're in favor?
Yes.
And Ron, you're in favor?
Yes.
Okay, and I am, so the motion has passed.
This is Bill Marsh. Thank you very much, ladies and gentlemen.
Thank you.
All right, we're signing off now. I'll be in touch with you, Megan.
Sure, talk to you soon.
All right, great. Bye now.
Bye.
Is there any other business that you'd like to discuss briefly?
I think I'm
I thought we were gonna. I think we were gonna talk about the value store.
Oh, that would have been part of my February report. You are correct. Give you an update on that. We have been going there weekly, and they have had a little rough start in the beginning, but they are in compliance. They've taken all their trash away from the wetland, and they have gotten a pest control contract and have cleaned and sanitized as required. So they are in good shape, and even though we're busy with COVID-19, we'll continue that.
How about the outside?
Yes, they've cleaned
How
up.
about the outside, Megan?
They have cleaned up all of the trash outside.
And all the,
Go ahead, sorry.
okay, all the outside is cleaned up,
Yes.
and is it verified that they have a purveyor? With up-to-date
Yes,
stuff?
yes.
Shelves?
We have gotten their food service invoices, so we do know where their food is coming from on a weekly basis.
Okay.
It is the Sharon, go ahead. I thought you were finished. Go ahead.
Okay, are they in compliance with everything else?
Yes.
In the border, what do you call the surveyors are out there looking at everything weekly?
Our inspectors are, yes. We have staff that go out.
Inspectors, yes.
Yeah, inspectors,
yes.
yep.
Okay.
Every
Okay.
week.
Okay.
Sharon, did you have a comment?
Yeah, I mean, do you remember we were talking about, I guess, the places where the mice and whatever were getting into. They had seen some holes where they thought they might be getting into the place. Have they been taken care of? The egress?
Yes, they've hired a pest control company and they have secured all of the entrances and exits for any sort of rodents or pests.
Okay.
Okay. Any other comments?
Are we going to go out? You're going to go through the poker stuff at all? That was in the papers that you gave us.
That was during our work session, and we decided to continue that into a date in the future.
Okay, so we're just going to continue that. Okay, all right, very good. Okay.
Do I hear a motion to adjourn the meeting?
Make a motion, we adjourn the meeting?
Second?
I'll make a motion to adjourn the meeting.
Matt, are you in favor of adjourning the meeting?
Yes.
Sharon, are you in favor of adjourning the meeting?
Yes, I am.
And Ron, are you in favor?
Yes. Yes.
And I'm in favor. Meeting adjourned.
All right.
Thank you, everybody.
Thank you.